Good afternoon, everyone. I'm Rob Satloff. I'm the director of the Washington Institute for Near East Policy.
Hi, good afternoon.
And through the wonders of technology, I'm delighted to welcome our guests today from Baghdad, from Amman, and from Riyadh, and our guests and participants from throughout the Middle East and around the world for what should be a fascinating, up-to-the-minute discussion on how key governments and peoples in the Middle East are addressing the coronavirus epidemic. Just a word, this is a live broadcast that is being broadcast both on the website of the Washington Institute and on Facebook Live. As we proceed throughout today's broadcast, all the participants, other than the speakers, will be in mute format, so only we and I will be talking. But if you have questions or if you have comments, I urge you to use the chat function on the website on Blue Jeans to send me a question, or email a question directly to me, rsatloff, R-S-A-T-L-O-F-F, at washingtoninstitute.org, and I will receive it and I'll be able to engage you and your question in our conversation. More generally, I urge you to take a moment when we're all done with today's broadcast to go to the website of the Washington Institute. That's www.washingtoninstitute.org for detailed background analysis on everything that has to do with Middle East politics and U.S. foreign policy in the Middle East. Especially take a moment, if this is in your language, to go to our Arabic Mirror website or our Farsi website for you to see some of our detailed analysis in those languages. Today, I'm really delighted that we can have with us responsible senior officials from the governments of Iraq and Jordan and Saudi Arabia to discuss this terrible pandemic and how the governments and the peoples of these countries are addressing them. Our guests today are Dr. Jaafar Allawi, the Minister of Health of Iraq. Our guests today include Dr. Saad Jaber, the Jordanian Minister of Health, and Dr. Abdullah Algwizani, the Chief Executive Officer of the Saudi Center for Disease Prevention and Control, the Saudi equivalent of the CDC. These gentlemen are all very, very busy. They all have real-world responsibilities, real-world challenges protecting the lives and health of their people. And so I take it as a great compliment, and I'm quite privileged that all of you could take time out to talk to our audience, which is really a Washington audience and a global audience, on the challenges that you and your government are facing in confronting the pandemic in your countries. So I've asked each of the speakers to make some brief opening remarks about the situation in their countries, and then we'll engage in a question and answer session and a discussion of the critical issues that they're facing. Why don't we begin first with Dr. Allawi from Baghdad. Dr. Jaafar Allawi.
Thank you, sir, and good evening or good afternoon to all my colleagues and to your good self. Yes, I would like to just briefly put you into the picture as far as the Republic of Iraq situation with COVID-19. Just briefly, the number of cases in Iraq is quite good, which is 1,927. The people who have been cured of the disease, 1,319. The ratio of people being cured, 68.5%. Deceased, 90. And the percentage of fatalities, 4.6%. This is up to yesterday evening report, and this will be which is updated every day. Now, just to how much time do I have? I don't want to extend my time.
No, please take. Yeah, please go on. Please take 5, 8, 10 minutes. Yes.
Okay, lovely. Thank you, sir. Now, I took over from a colleague of mine who resigned. He was a well-known public health officer, the Minister of Health, who is now in Geneva for some political issues. And the ministry was left for 2 to 3 months with no minister, and I was called to take over as a crisis management. And I started about the beginning of November, end of October, November last year. Unfortunately, Iraq, during the 40 years of wars and troubles, has been left with less than acceptable standard of health services. The health services in the Republic of Iraq until 1970-71 was one of the best in the Middle East. We had those days very high caliber medical schools. We had very powerful medicine industry, ambulances, you name it. We have very high caliber of nursing. Unfortunately, that is not true anymore. Now, this is one problem. The other problem, of course, is financial. Iraq is totally dependent on our income from oil, and that has dropped enormously. 3, we had a lot of riots in the streets of people wanting changes in the government. And 4, we had the problem with Corona. Plus, the government that I'm part of at the moment has been a take-care government for such a long time, so decisions had to be reviewed on several stages, including Prime Minister's involvement. So the decision in Iraq was extremely, extremely difficult. Now, the beginning of the disease was in China, and there was 63 students with their families in the area where the disease started, Wuhan, and we had to evacuate them. Our hospitals are not exactly as good as when I left Iraq in the 70s. But we managed to evacuate 2 hospitals, one near Baghdad airport and another one which was a cancer unit. We left those 2. We prepared them for the evacuated students. The students arrived about 2 months to 3 months ago, and they were all quarantined for 14 days. And luckily, none of them had coronavirus after 14 days of incubation, and they left the hospital. At the same time, about the same time when China had the disease, we had information that the neighboring country, the Islamic Republic of Iran, has quite few cases in the religious town of We contacted the embassy and to find out exactly what's happening, but unfortunately the decision was not taken immediately in Qom, and Qom was left open to people traveling in and out for the purpose of voting for some reason. This worried me enormously. We have about 1,400 kilometers, about 1,000 miles, borders with the Republic of Iran. We have intermarriages. We have a sect which is constitute like 50%, if not more, of Iraqis who have the same religious beliefs like Iran. We have traveling in and out of Iran. We have a lot of trading between us and Iran. To take a decision to block the border was enormously difficult. I was under a lot of pressure, and there was a lot of complaint, but I had to take it. I have no choices. I have very under our medical services, according to the WHO, is for crisis management is located near, unfortunately, Oman, Somalia.
All right. We will come back to our guest in Baghdad. Let's, if we can, Dr. Jaber, can we turn to the situation in Oman and in the Hashemite Kingdom?
Yes. First of all, good afternoon to you, to all your colleagues and all your audience. Thank you very much for hosting me, and to my colleagues, the minister and my Saudi colleague, Ramadan Mubarak, which is the holy month of Ramadan for us. Thank you very much for hosting me. Well, the situation now in Jordan is quite under control. For the last few days, we didn't have any case reported. Most of the cases reported were for truck drivers coming from abroad because the trade has not stopped, though the borders were stopped for regular passengers. So most drivers are truck or lorry drivers bringing goods to Jordan, and we test them at the borders as part of our protocol. We had quite a few numbers in the last 2 weeks getting those drivers coming from abroad. We either put them into isolation, bring them to the hospital, or if they are not Jordanians, we had them kind of agreement that they go back. Also, even those truck drivers, Jordanians, not found to have the disease, we put them in home quarantine for 14 days. So the situation is kind of good, and for the last 1 week, we are opening the commercial part, which has been locked for the last 40 days. We are opening and slowly and gradually the commercial part. We started with the small shops early, then we gradually started opening them, bakeries, shops. Then I'm sorry, can you get me? Yes.
Yes, you're fine. Please go ahead.
Yes. Then we started moving people, hospitals, private, some clinics, not private clinics, were the last things to open. So now we are in a phase where almost we are back. Almost 70% of our economy and people are moving. We still have some lockdowns. We have closure of everything after 6 p.m. And on the weekend, on Friday, we have total curfew. I think our situation is kind of good, but vigilance is extremely required. We are opening a new phase now in Jordan, bringing students from abroad. A lot of Jordanian students have been kept abroad, and a lot of them in countries where the cases are still high. So we are preparing for quarantine for thousands of students, and double testing at the airport. And after 14 days of quarantine, we have to test them. So we are preparing the logistics for that. This is the general situation in Jordan. It's under control, and I hope everything around us in the Middle East and in the world as a whole, things will be under control.
Thank you very much, Dr. Jaber. We'll come back in just a moment to hear more about Amman, but first let's return to Dr. Allawi in Baghdad to complete your opening remarks.
Sorry
of course.
About we had electricity problem. We have a situation with preparedness, equipment, education programs, preparing personnel, and to put Iraq on its feet to stand up for this virus was quite difficult, from political, financial, and preparedness. But we started with a lot of equipment, mainly for PCR and rapid tests. We started in Baghdad, then we have now managed to cover all Iraq, including Kurdistan. The test we started with was only for people arriving to Iraq or people who were complaining of symptoms. Then we moved, now we have the capacity to start locating areas of high condensation, and we are starting to evaluate these areas by sending medical personnel to check for positivity or negativity of COVID-19. Going back a little bit, for Iraq, preparing Iraq to fight COVID-19, other than the borders with Iran, we have a situation where people have pilgrims for the Shiite imams. And this is, of course, again, not easy. I had to ask the high clergy, both in the Sunni sect and the Shia sect, to reduce the close attachment of people in mosques and pilgrimage. And I'm lucky to say that the high command in the Sunni and the Shia sect stood by us, by the Minister of Health, and the visits to these sites, including a large number of mosques, was stopped. We had small amounts of leaks, so the visits to these sites, the Imam's site and to the mosques, was reduced to about 5 to 10%, which again has helped us. We have the help of the Chinese government, which supported us with a lot of kits and equipment. The government of Kuwait has contributed a large amount of money. The Central Bank of Iraq and the private banks. Financially, we are okay, and we have been promised by the United States government as part of the strategy between Iraq and the United States to help us financially. And I think there is a team negotiating now, or in the process of negotiation, to get Iraq some support, financial support from America, from the United States. This is the background, and the difficulty is that the ministry has faced. Luckily, with the closure with Iran, followed by Turkey, Kuwait, and then on a special agreement with our brothers in Jordan, the borders was also closed. The closure of the borders and initiation of curfew has helped enormously. Plus, we have the schools, from primary to high schools to universities, were all closed. These measures has helped, and I'm sure they did. The other issue we have now is with the WHO support, and they have really helped us a lot. We have the help of London University, where I worked there myself for a long time. I have a lot of colleagues there, and one of them is well known to most of our colleagues, is Professor Rawaf, who heads the Department of Public Health at Imperial College. The two worrying things which I want to share with you people, with my colleagues, with you, is the report that came from China and Korea, Southern Korea, of the recurrence of the disease and the people who were cured. There is something that we need to find out. I have emailed our colleagues in Geneva to find out if they have some information about this. The other issue, which is also important to all of us, is the type of virus, the COVID-19 virus. In Europe, the fatalities, as well as in the United States, is way above what is happening to Jordan and Iraq, way above. This triggered the question, are there different viruses? Because the health services in the United States, Britain, France, Italy, are much better than what we have here. And I was worried what is happening. Why are we way down in numbers of people affected compared to London, for example, to Europe, to Britain? And when I put the question to my friend in Imperial College, he stated that they are thinking that there are 3 types of viruses, A, B, and C. And one of them is attenuated, one of them is medium effectiveness, and one of them is a very high-risk virus with extreme fatality. The Chinese reported recently in a reputable journal in JAMA that there are 2 types of virus, and they called them L and S. One of them is, again, very aggressive type of virus, which affected like 70% of the people in China. The other one is less serious, and people who are affected with it usually have very minor symptoms, and they get cured easily, self-limiting condition. These are the 2 issues which worries me, and I still don't have answers to them. We are now okay in Iraq. We have enough personnel, heavily trained. They are now moving into areas. We are locating areas that has high compensation of people. And hopefully we can contain the disease at this level. The curve is not escalating, it's not exponential, and it's now plateaued. The other worry I have is the number of Iraqis who have decided that they want to come back home, and we have a large number of them. Yesterday we received about 1,200 arriving only from Russia, and we have a lot coming today from Spain, from Italy, from Britain. And this, I hope that there are no 2 types of viruses, which will put us under a lot of difficulties. Here, I think I have given enough information. I will leave it and go back to you, sir. Thank you.
Thank you very much, Dr. Allawi. And now we'll turn to our guest from Riyadh, Dr. Algwizani, the head of the Saudi CDC, to offer a perspective on the situation in Saudi Arabia. Dr. Algwizani. Dr. Algwizani?
Yes.
Please, the floor is yours.
Yeah, thank you very much for inviting me to be part of this discussion. Firstly, I would like to acknowledge the tremendous effort of our essential worker across the public health, the scientific community, and the healthcare sector, as well as the heroes who are ensuring that all essential services are running during the pandemic. Saudi Arabia is the largest country in the Middle East, with the 5th highest population in the region. And we had invaluable prior experience with MERS-CoV, which is, although in different scale, has helped us in our response to COVID-19. As of today, we have just over 20,000 cases with around 150 deaths, and we have seen an increased number in cases, which is in direct relation to our strategy scaling up the testing to in the past few weeks. Just to set of the context of public health in Saudi Arabia, Saudi Center for Disease Prevention and Control, which include the National Lab, was established in 2018. So we are a young, growing organization with a small and highly skilled team. Since the first case were reported by WHO, Saudi Arabia has proactive in its response. In January 2020, the coordinating committee was established by the Royal Court, which chaired by the Minister of Health. This multi-sectoral committee that meets daily to monitor and respond to the emergency cases. Initially, our focus was to take precautionary measure at all ports of entry and on the repatriating our citizens from country with emergency cases. Travel to and from China was suspended in early February through March and thereafter. And the travel ban has been restricted to all countries later on in March. One of our biggest priority, as you all aware, is the Umrah, which was you might know it's the pilgrim to Mecca for all Muslim, and they perform it most of the year. The decision made was to suspend Umrah visa by the end of February, and the whole, which was extended to all citizens by beginning of March. Our first case was in March 2020 in a small city in Eastern Province, and we were able to trace this at the point of entry, which was across the border by the land. We began contact tracing, and this was the beginning of the cluster. We put the city under quarantine, and the cases has tremendously dropped in the city afterward. There are several additional measures put in the first 2 weeks of March, include suspension of international travel to and from several from most of the country. As a preventive measure, educational institutes such as schools were closed down, and early e-learning was implemented soon after. Travel between the cities and towns was banned also, and it was replaced by special permit under each special permit to travel as if the curfew is in place. Malls and other places of mass gathering, include mosque and business, were also closed down. Remote working was recommended, and events were suspended. Of course, essential public services and sector related to food and beverage have remained open, but with proactive measures in place. Our healthcare sector fast response has been pivotal in ensuring that there is a capacity to look after COVID patient. We identify a dedicated we dedicated 25 hospitals across the country to meet the expectation to increase in demand, especially in critical care. His Majesty King Salman issued a decree last month, which means all citizens, residents, and even those who's living illegally receive a free treatment for COVID-19, irrespective of whether they receive a public or private healthcare facility. I think a key priority is to ensure those who has a pre-existing condition, which can lead to increased capacity in the health system and mortality. And we need to understand the number better in terms of for their requirement. In addition to the building capacity of testing and tracing and containment, and we're scaling up our testing measure through the whole kingdom, targeting between 50 up to approaching. We try to reach out to high number of testing per day to ease and contain the any need for testing, for contact tracing, and etc. Still, there is a cases, and for the last weeks, it's been through certain activity of disease, but we started to lift certain measures. For the curfew, we started ease the measures in the during Ramadan from 9 to 5 p.m. Given the fact that most of the city except Mecca, just as a precautionary measures. We yes, and our measures, our precaution measures was just to ensure flattening the curve as much as possible, and to ease for the health system to ease and accommodate the disease. Luckily, we have so far we've been in containment phase, and there was no scaling up of the cases. Despite that, we are extending our upscaling our testing. Working with the international community is always an important for us. We are active in different areas, particularly in the G20 as the host country. Saudi Arabia has pledged $500 million to international effort to combat COVID-19, including donation to WHO. We are also part of other international committee or our community to combat and help sharing our experience with the COVID-19. Lastly, I would like to thank our colleague Saudi doctors. I think we have more than 6,000 Saudi doctors around the world. They decided to stay at their country, at the country that they are studying or working there, to help other countries to combat COVID-19, and we are thankful for their effort. Thank you.
Very good. Thank you, Dr. Algwizani. If I could, there you go. Just leave it like that, because now your screen is on. Let me ask a couple of questions before I turn to some of the questions that are sent in by our viewers. First, I'm interested in compliance with all the difficult measures that your governments have put into place. What have been some of the most difficult obstacles, either groups of people, regions of people? Have there been any difficulties in compliance with social distancing, with lockdowns and curfews? How have you managed this, and how would you evaluate the issue of compliance? Let me start with Dr. Jaber in Amman.
That question was for me?
Yes.
Well, actually, because we started a very good media campaign early, maybe late January, we had a very good and effective media campaign. So when it was started aggressive measures of curfew or social distancing or whatever, people had built some trust with the government, and they obeyed in a very nice way. We moved as one team. So the media campaign before starting the harsh measures was very impressive and very good. Some measures were hard for them, like prayers, like especially in Ramadan, or Jordanians like sweets. Stopping the place, shops for sweets was very hard, but they all stayed home, actually, at least for a couple of weeks. Then people with the special permissions were allowed. So actually, the compliance was very excellent, which helped us control the disease greatly. That was one of the most important steps in reaching those low numbers we have.
And Dr. Allawi, how would you evaluate compliance? Your country has different regions, different groups. Was compliance uniform throughout Iraq?
Yes, you're right. We have difficulties. We prepared high caliber media people from the day we started, like our colleagues in Jordan, end of January, to talk to at different levels of education of the receiving people, receiving parties, on TV, on radio, and in other social media, preparing people of the importance of prevention, distancing, wearing masks, gloves, washing their hands, maybe with soap. The compliance in the beginning was not adequate, and then it started improving gradually. There is a lot of resistance, of course. There was complaint that there was not enough masks or gloves. The prices went sky high, but then a colleague or the Minister of Industry in Iraq helped us a great deal in producing masks at high, about 75,000, almost 75,000 masks a day. And this was launched as free to the public. And this brought the prices and corruption down, because most people were selling them for about $7 a mask, ordinary mask. That dropped back now to about $0.50. The Minister of Oil Industries helped us because we used to import the disinfectants from United Kingdom, and that is now manufactured in Iraq, and we can actually disinfect large areas, and that is now distributed all over Iraq, and we get it free. Many organizations in Iraq has been involved in supporting our case, and the farming areas and to the industrial areas and schools. Well, schools were closed, but educating people on preventative measures. The compliance, I would say, not exactly as much as I would have liked it to be, but it's okay. The problem I have again was the curfew, which we have eased up a little bit during Ramadan. Many people went out in the streets. I think they felt it's like freedom, like it's a happy day. I suppose I can't blame people. They have been under curfew for at least 2 months. Compliance at curfew. Now, we gave our curfew was eased up, and people were allowed to go out for shopping from 6 o'clock in the morning till 7 at night. Because of the slight increase in numbers, we have dropped it down now to from 6 a.m. in the morning, they are allowed to go out till 6 p.m. We are going to restrict the cars traveling in big cities from from odd numbers license and even numbers, which is distributed on and off days, to reduce the numbers of cars going into the streets. These are the measures I took because of compliance. Okay. And I hope I will, I keep saying I, but I mean the Minister of Health, right, because I'm not working alone. So we hope that we will win in the long term. There is an issue of heat. The temperature is rising in Baghdad, in Iraq, and hopefully they said that contaminated areas and the virus does not live on. The formites do not live for a long time on tables and chairs and stuff like that. So hopefully, if the theory is right, I'm hoping that the curve will go down rather than just being plateaued. Thank you.
Right. Dr. Algwizani, can I ask you, there's great fear in the United States about round two, the second phase of this, that people have great trepidation about in autumn or winter. Now that you have been through or are going through phase one, do you think you're adequately prepared to address what could be an even more difficult and virulent round of this sometime in toward the end of this year? Dr. Algwizani, your audio is not on. Please press. Please press.
Yes.
Don't touch your camera.
Yes.
There you go. That's fine.
Yes. Thank you, Robert.
Go ahead.
Yeah, I think it's still there is a concern about the impact of winter on this pandemic, and I think we share all these concerns about how would be the pandemic will react and behave by the winter. The problem is, as you probably know, in winter, there is activity in other respiratory viruses such as seasonal influenza and others, and so these also can be an of a strain to the healthcare system, of course, in all the world. I think it's something that we need, and I think we are doing preparing ourselves for such scenarios by next winter, just to ensuring the community precautionary measures, just to mitigate this risk by having the social distancing in all the community, understanding how the virus is behaving, scaling up the mass testing, preparing for optimizing the infection control practices in the hospitals. We have actually vaccinated 4.5 million last year for influenza, and we'll continue to vaccinate influenza for this year before the winter, ensuring as I said, this social distancing and preparing and scaling up the preparedness is, I think, crucial, given the fact that there is no vaccine right away for COVID or an effective treatment for this. So still implementing these measures. I think we share this. We share this concern about the next winter. Hopefully, that by that time the whole community in the whole world is prepared for that. Over.
Dr. Jaber, there's a special concern in various places about conflict zones, about refugee populations. Jordan has quite a substantial refugee population. Was there any unique aspect of trying to enforce curfews, lockdowns, etc., or the compliance, or the ability, or the addressing the COVID challenge with your substantial refugee population?
Of course. I mean, we have more than 8 camps. The largest one got near 80,000 refugees. Well, the same rules applied to Jordanians were applied to refugees. We stopped the schools. We had lockdown around them. We started a campaign of surveillance like the rest of provinces in Jordan. We opened some clinics with some training to the health workers there, how to deal with coronavirus. And recently we opened a mobile hospital, and Jordan now is building 2 or 3 mobile hospitals that can host up to 16 ICU beds and other issues. We cooperate strongly with WHO and UNHCR in dealing with the refugees. We had some training to the population there, how to avoid get infected. We prevented people from coming in or out, as in every aspect of Jordan. It is very difficult to have social distancing in such camps, but we had training to the people how to avoid gatherings and so on. So what happened to Jordanians happened to the refugees. Luckily, we didn't have any case in those camps, and this is due to the harsh measures we took, not only in the camps, everywhere. We are ready to deal with any case, but I hope we won't see anyone.
I mean, a question really to all of you. There is the official numbers in all of your countries are relatively low. Now, one could say that this is due to the impressive measures that you all took to limit the spread. One also assumes that there's some underreporting or lack of testing. How serious do you think is the problem of underreporting, lack of testing, embarrassment to come forward, reluctance to discuss the issue, social stigma that might come from addressing this issue. Is that are these serious challenges in your countries? Dr. Allawi, we'll begin with you.
Yes, thank you. All the above, to be honest with you, all what you stated is correct. People were hesitant to come forward, but to be honest with you, I know the number of tests we were doing was not sufficient. But with the increased numbers, we had very slight increase in the actual people being diagnosed. Now, that worried me, and we got, because there was a report on one of the main media, I think, I should not mention the name, but they reported that we have tens of thousands of people affected in Iraq. That was not true. Because all our reportings come as scrutinized by the WHO Center in Baghdad. And we also, I requested from our forensic departments on the fatalities and all-cause mortalities numbers reported by hospitals, general practitioners, and even families. The numbers do match. We do not have more fatalities than the ones I mentioned earlier. Because these people have to be buried, they have to have certificates, they have to be checked by police. So burials of deceased matching the numbers that we stated. Now, why we have less numbers? As I said, there may be a possibility that there are two different types of viruses or more. The type of weather, and they even mentioned that the number of people being vaccinated, anti-TB. So there are many theories. I can't pinpoint the exact reason why the numbers are limited, other like us, Jordan, and our brothers in Jordan and Saudi Arabia. The measures we took to prevent by closure, curfews, stopping schools, were not taken in Europe and I suppose in the United States. They were very relaxed, and when we watch TV, sometimes I even saw prime ministers were traveling amongst people, undergrounds were working, borders were not closed, airports were open. Until very late. I think the measures that were taken to prevent the disease from spreading in the Western world, at least, was taken rather late. That is the explanation, I think, one of the explanations why we have less in Jordan, Saudi Arabia, and Iraq numbers of people affected.
Dr. Algwizani, Dr. Jaber, do you have unique explanations why, beyond the effective measures that you're taking, why the numbers might be relatively lower in your countries?
Should I answer, or Dr. Algwizani? I no problem. Well,
please, Dr. Jaber, then I'll go to Dr. Algwizani. Yeah.
Yes. Well, we had the genetic sequencing of the viruses in Jordan, and I would like to say that most viruses in Jordan have come from the States, Belgium, Australia, and some of them from Britain. We didn't have any virus that has come from China. We analyzed 30 types, most of them coming from the States, Italy, Belgium, and Great Britain, and some of them came from Australia. And the route from Australia was very strange through Belgium. I don't know how is that. I mean, we analyzed them with one of the centers in San Diego in the States. We sent our viruses. So I don't think the virulence of the virus is different in the United States from those in Jordan or in Iraq or Saudi Arabia. Maybe the genetic composition of Arabs maybe is different, but the genetic composition is comparable to Arabs and Jewish people in the States, and the prevalence of the disease is comparable, is high in those ethnic groups in the States, comparable to other ethnic groups in the United States. So It's not our ethnic composition or genetic composition. So I would say the measures. You were saying about underreporting. Well, transparency in the region was, and honesty, talking to the public was one of the issues we stressed on, because the people has to trust you when you take measures. So we were transparent and honest. And you see the numbers in even, in Saudi Arabia and Iraq, they talk the true numbers, because there is no interest, or you shouldn't hide such a grave thing from your people. And I think underreporting is not an issue. Maybe testing capacity. Well, we started with low testing capacity in Jordan. I'm sure the same in Iraq and in Saudi Arabia. And we are increasing the number steadily. We started with 300-400 a day. We are now in around 4,000 a day, and we are reaching 10,000 tests a day, which is comparable to the testing capacity of the states. I know in Saudi Arabia they will go further than that in a few weeks. In Iraq, they are increasing also. So maybe it's multifactorial, but definitely the measures we have took, was of prime importance in decreasing the number and flattening the curve.
Okay, thank you. Dr. Algwizani?
Yeah, I think one thing that we must know, that the unknown about this virus is much bigger than what we know about the virus. So I think there are a lot of unknown about how the virus is still, why it's different from country and other country. So still this need to be further studied and evaluated globally. First of all, Saudi Arabia started with capacity of 12,000 tests, and now we are approaching up to 22,000 tests a day. We are approaching almost 300,000 tests since the beginning of the crisis or the pandemic, and we are scaling up the testing with the approaching almost 9 million tests for the whole year, just to expedite our response to this COVID, to our management to COVID-19. I think we one of the things that has raised our cases actually that we go actively finding the cases, try to isolate them and trace them, and we are doing that. And with full transparency about what and how much cases that we have, we are doing it. We have been doing it since MERS-CoV, and we'll continue to do it. We are the same that we are doing every day. Scaling up the testing is an important thing to discover cases, as well as I think what has helped us actually is the preventive measure which was been implemented much earlier. Travel bans, social distancing, closing of the some of the border, curfew, and also ensuring social distancing in the whole country was of great help to at least ease the number of cases through this period. And still we are not over. We still continue to hold our breath, and we continue to fighting this virus over.
Okay, so I have quite a few questions from viewers around the world who have been sending me questions. Again, if you are watching this on Facebook Live, you're welcome to send me a question directly at rsatloff, RSATLOFF, at washingtoninstitute.org. Or if you're watching this online at Blue Jeans, use the chat function. So one question is about the economic challenge that has been triggered by the health challenge. Here in the United States, we've been thrust into a Great Depression with the numbers of unemployed already hitting the numbers that we had in the early 1930s, and government has responded with a massive public spending to try to help counteract the economic depression. Not all of your governments have the resources that the United States has to try to address the economic dislocation. How are you dealing with the economic side of closures, lockdowns, the suspension of much of the economic activities in your countries? Dr. Jaber?
Well, I know His Majesty the King is, guiding this battle, the economic one and the health one altogether. From the first day of the curfew, we allowed the first or the biggest 65 companies that export things and are responsible for almost 70% of the Jordanians' economy to work under strict health conditions, which allowed us to restart our economy under very controlled conditions. Also, we allowed the factories first, and we put very strict criteria for them to work. So before going back, to normal or near normal now, as we are easing the curfew, we started with the economic one. The government launched the biggest and the first, or the biggest, donation campaign in Jordan from banks, from big companies, and it was able to serve a lot of people who work day-to-day labors, that they are not, they don't have social security or other things. And we were able to support more than 150,000 families, with these donations and with the help. Also economic things that the Central Bank of Jordan and other banks allowed for loans to be given, and the government will pay the interest, for those loans, if you are going to take them to pay the wages for workers, so that we don't have a lot of layoffs, which has been minimal for the last couple of months. Then we early go back to the economical, work, and to start slowly working nowadays. This will ease the economic burden that might happen. A lot of things had been done by the government, by the people. Charity has been worked very hard. To gather a lot of things, helping people. So, yes, Jordan has fragile economy, but we hope to recover soon. I don't know for how long we will suffer till we go to the pre-corona status, but I believe it won't be long unless another wave, as you said, might come. Thank you.
Dr. Jaber, I received a number of questions specifically for you, asking about how the political situation in Baghdad, the uncertainty, the pursuit of multiple prime ministerial candidates, that sort of thing, how that has affected national decision-making, how that has affected your own efforts to try to confront the corona crisis.
Yes, you're right, and the questions are important, really, because we have a cabinet change coming very soon, which puts us all under enormous pressure. As I said earlier, we are a caretaker government, so the decisions are difficult. At the beginning, we had enormous financial difficulties, but luckily, the Central Bank of Iraq and many private banks immediately helped us. We got like $67 million in no time. And then we have an arrangement with the Minister of Finance, which were allocated another $70 million a month. This money, which funds we have received, are, I would say, adequate to help us keep the campaign rolling. The political situation is difficult. Iraq is now, possibly there will be a government change. I heard it probably would be a Monday. Many ministers will be changed. I'm sure the Minister of Health will continue the same momentum. If anybody takes over from myself, I'm sure he will be better than I am. We are okay. Iraq is okay. We have large capacity people, high caliber doctors, engineers, pharmacists, medical teams, nursing. We are now prepared. So any change in government or change of the minister level, the continuous program will continue. The only thing I hope is that we will not get a larger epidemic in Iraq because our capacity will handle what we have, 50 to 100 cases a day, and at the same level about of that number cured. More than this will put us under enormous strain. If something happens, God forbid, like what's happened in Europe, I think we will be in serious trouble. Thank you.
Dr. Algwizani, this crisis has occurred at a moment when there's been a collapse of the oil market, oil being the principal source of revenue in your country. Has this affected the health system's ability to respond and to plan for future phases of this crisis?
As I said, I'm not an economist. However, the assurance of the amount of support to the health system is of great priority to combat this pandemic. As I said, the government pledged, Saudi Arabia pledged to $500 million to combat COVID-19 in a global level, including the donation to the WHO, just to combat and accelerate the discovery of the vaccines. This thing actually will hopefully alleviate and expedite the roadmap or the road to identifying and finding the vaccine soon, within this year or maybe next year. Over.
I have a lot of questions from people asking about international support to your countries, and specifically the extent to which, if any, the United States has been helpful. I know that Dr. Allawi, you mentioned earlier that there's discussions with the U.S. government that you hope will result in some financial support. Have there been, has the United States been a source of technical support, of substantive support in terms of health goods, of financial support, of private sector support, or have you, in this crisis, really looked elsewhere in the international community for support? Gentlemen?
Yes, the United States. Sorry, can I ask? Yes, the
please
United
go
States,
ahead. Then turn to Dr. Jaber. Yeah, please.
I had several discussions with His Excellency the Ambassador of the United States in Baghdad. We discussed this issue at length, and we are in good position now how we can get United States support. They have also the military forces in Iraq has supported us with the many items that is used for laboratory investigations. The know-how, we are going to shortly be in touch with the American colleges, American College of Physicians, the CDC in the United States. We have a lot of support from the United States, I must say, and I'm really grateful. Through you, I would say thank you to the United States. We are through the Foreign Office, we are in communication with the United States, and I am like every 10 days to 2 weeks in communication with the the American Embassy in Baghdad. So we're okay with that. We have other support from Kuwait. We have some support from France, and we have many donations from private Iraqis. There are very wealthy Iraqis all over the world. the numbers of immigrant Iraqis living in Europe, America, reach about 10 million. And many of them now are happy to help. Some of them are even returning back to Baghdad during that period, I suppose.
Very good.
Yeah, thank you.
Thank you. Dr. Jaber?
Well, the cooperation with the international community is very strong in Jordan. And as you know, Jordan carries very excellent international relations. At the beginning, we had a big need for PPEs and personal protective equipment, and testing kits, which, we were asking from abroad. And by the instructions of His Majesty the King, just to start making PPEs. And so we started trading with other countries like prehistorical ages. I have excess medication in this one, but you have excess. So we started trading. Getting coveralls from this country and send them maybe hydroxychloroquine, which they needed, and we are producing. Now we are producing Jordanians' needs from masks, and we are able to export. In the next week we'll be able to export coveralls and masks. So we trade some. We get some from here. We send them the excess. We get the needs from others. It's kind of, I don't know how to say it, but it reminds me, in the old villages, you take this and
it's the barter system.
And take some meat, something like that. So the international community is helping each other. We send some medications we are producing in Jordan to other countries. We got some PPEs from others. Now we are sending PPEs to other countries while getting some tests. We are talking, to the United States to give us the new gene expert test, while asking, the Swiss to build us the huge testing machine to improve our capacity, while sending to other parts of Europe some PPEs or some medications to get something. It's kind of complicated, but it's nice to have it,
All right, if I could ask one final question to all of you, then we'll be closing today's session. There is a goal, obviously, to get back to normal, to get to the pre-corona era. But I think most observers say that even the post-corona era won't be like the pre-corona era. That we will all have gone through a changed experience, and that our countries, our governments, our health systems, our societies will be different for that experience. When you think about what will be different as a result of this, what do you focus on? What do you think the biggest lasting changes of this experience are likely to be? We'll start in reverse. Dr. Algwizani.
So I think as an infectious disease specialist and public health specialist, I think this the COVID pandemic has enlightened that the need of all the community, the whole world, to be prepared for such a pandemic. I think the very importance of ensuring what we call the One Health approach to really work in multi-sectoral, intergovernmental relationship, and also multi-sectoral in the country itself, to survey and predict what would be the next disease or next viruses will come in the next pandemic. This pandemic, risk of pandemic, it will continue with us. As long as we live, we will find a way through this pandemic and COVID-19. But we have to learn our lessons from this pandemic to be prepared for the next pandemic, which will be, I don't know, maybe 10 years or less than that. As long as we are interacting with the whole environment and all animal sectors, we will get this viruses, and no doubt, it's not if, it's when. The most important thing I think we know is how the social and also the whole government working toward preventing and counterattacking this virus. And I think it's this pandemic has showed us in how can we all work together, an interagency to combat this virus in a much wider scope. This pandemic, I think what it showed to us is actually it's not a health issue, it's a health, economy, social. So it's a wider scope, not only the health aspect. So it needs to be seen and from the whole wider scope of approach. From Saudi Arabia point of view, I think this one also has helped us to improve the social distancing issues, and how can we deal of raising our awareness through the tackling and managing the pandemic. One thing is, I think one of the gain of this pandemic, if there is a gain, is that a lot of work can be done from abroad or online. You can work and you can be productive, and a lot of high important meetings, such our meeting this, it can be done through online. Working at home is, I think, one of the things that we are emphasizing, and we see how this thing goes on this over.
Okay, thank you very much. Dr. Jaber, your view on the lasting implications of all this.
Well, it's kind of complicated. You know, the first thing, the world will be totally different. It won't be the same as before COVID-19. Well, the first lesson, I mean, we will learn, all of us, is to appreciate our freedom and the things we have. Also, we will appreciate that the virtual world, or the world of the imaginary world of social media and things, is not sufficient for that. We need social contacting, and we need other people, you know. We also, as my colleague said, health and economy and other aspects of life are together, and they have to work together to improve the quality of work, of living of the people. The other thing is that sometimes you have a lot of money, but there isn't much goods to buy, or you can't get them. I mean, if you can't find PPEs or testing kits, what the hell? I mean, why do you need sometimes the money? We had the money, but we couldn't buy them, I mean, from the market for some time. So, I mean, we have to depend sometimes on ourselves in getting what we need, to be adaptable. I mean, to adapt to situations where we have to make ourselves our needs. And this is everywhere in the world. And the other thing is we have to stress and go to agriculture, because, I mean, the borders are closed. There is travel ban everywhere. So you need to get to have your agricultural system very good, so that you can eat, I mean, in the future. You might have something worse in the future. So, yes, international cooperation is great, and it has been helpful. Improve your national system, and also most of the things we used to have, you know, quarrels, political things, when you have a big issue like that, unity is very important to combat such and to go victorious. That's very important. Thank you.
Thank you. Dr. Allawi, your views on the lasting lessons and implications.
Thank you very much. Okay, yes. Now, there will be some changes, at least in Iraq and the Arab world, our social life. The shakes, handshakes, the hugs and the kisses have disappeared, and now is an accepted fact in life. Before, it's just a standard procedure that you hug your friends and so on. Nargila, you know, the bubbly stuff that people smoke has now dropped a lot, and I don't think I hope they will not go back to them. So people attending what we call chai khana, the place for tea, the coffee shops. So the social life has changed. we have slight increase in number of home violence, and probably because the man is not working anymore. So that I hope will not affect the issue once we are out of this pandemic. The economy of Iraq, which was totally reliant on oil, I can see some hope in our agriculture. Iraq now is producing large quantities of rice, vegetables. In fact, we have abundance of it. I heard from my colleague, the Minister of Agriculture, that Iraq is now ready to export rice and wheat. This has put the farmers at a different way of thinking, that either of my country needs me, or whether it's the opportunity now the borders are locked. So they are in full power producing good meat, chicken, food. So our industry from agriculture and our actual industry is now functioning in full capacity, which was not working for many, many years. So there are issues as far as Iraq is concerned. The enclosure of computer systems now in education at all levels have now become an acceptable fact of life. Final years in high-caliber universities are taking exams through internet. So I believe there will be some changes. There is economical changes. But as far as Iraq is concerned, I think it's not going to be that bad. What I see that we are now at least eating good quality vegetables, Iraqi made, and we are eating good quality rice, wheat, potatoes, and so on. So it's not as bad as in other parts of the world. And I hope it will continue after I leave. Thank you very much for inviting us. That's my conclusion.
All right. Well, gentlemen, this has been a fantastic and eye-opening discussion. Technologically, the ability to be able to talk to you, Dr. Jaafar Allawi in Baghdad, Dr. Saad Jaber in Amman, Dr. Abdullah Algwizani in Riyadh. This has been an eye-opening look at how you and your governments have been addressing the pandemic. And I want to thank all of you and wish you all continued success, and as you look at the next phase in the future of this. So I want to thank you, and I'm signing off from Washington, and wish you good health and a Ramadan Kareem to you all. Bye bye.
Thank you very much.
Bye bye.
Greetings.
Thank you very much.
Take care.
Thank you.
Yeah. Bye.